Stream is live.
All right, Mrs. Holman, you have the floor.
Thank you. Thank you all for joining us. I am Jennifer Holman. I am the superintendent for Northwestern Lehigh School District, and thank you all for joining us tonight, whether you're joining us live or you're rewatching this video at a later time. Tonight, you'll hear from Dr. Sosnovik and I about the data that we've collected through the first marking period. This will provide a review of the COVID-19 data to date that we've used for our decision-making to make informed decisions. These decisions involve our instructional delivery model, which you will hear about tonight. Dr. Sosnovik will begin by reviewing the data sources that we use to collect the data, as well as county and zip code data. We will review some survey data on the instructional models, advantages and disadvantages of the models, the guidance from a public health perspective, and next steps as we approach the second marking period. I will turn it over to Dr. Sosnovik first.
Thank you, Mrs. Holman. Let me bring up the presentation. Can you see the presentation?
I can.
All right. So I will begin by providing an overview of the COVID data we have available to us that aids in our decision-making efforts. Our goal is to provide the school community a better understanding and transparency of the key elements that are considered when making decisions during this pandemic. Northwestern has only access to data provided to the general public through the various national and state COVID dashboards. These dashboards provide COVID data from a cumulative perspective down to a zip code level. Types of information available to us are the number of confirmed, probable, and negative cases and tests, in addition to the number of deaths and hospitalizations broken down into various demographics such as age. These dashboards are summaries of the data that is reported in the Pennsylvania National Electronic Disease Surveillance System, or PA-NEDS for short. This is a database where healthcare providers report information to the public health department. The challenge with this data is twofold. First, the Department of Health only gives us data in these summary dashboards and not access to the actual data in spreadsheets so we could do our own analysis. Therefore, we have to pull this data manually each day so we could look at Northwestern specific data. Second, the data is not reported by the school district, but only zip code. As a result, since made available, we have collected the data from these dashboards to aid in our decision-making efforts and drill down to a district level and provide those insights. As you can see from this graphic, school districts are often made up of multiple zip codes and counties. The image on the left shows Lehigh County school districts, but what is not shown is that a percentage of some of those districts fall outside the Lehigh County boundaries. Northwestern, for example, encompasses several zip codes that are not entirely in our school district or even Lehigh County for that matter. Here's another graphic that illustrates that point. Of the 9 zip codes that are in our district, only 3 of them are entirely ours. This is important to recognize this when we are examining zip code level data. If we would account for all the COVID data available for each zip code, we would potentially be artificially increasing local school district numbers and not examining Northwestern through an accurate lens. To overcome this challenge of the state not providing us with school level data and artificially skewing our numbers due to zip codes, we elected to apply proportions, or in other words, weighting the data. We examined the square mileage of each zip code and assigned an approximate percentage of COVID data to the district using conservative estimates. For example, the arrow is pointing to 19530 zip code, which we all know is Kutztown. And we estimated that approximately 15% of that zip code data should be associated with our district. We recognize that this is not an exact figure and that theoretically all the COVID cases occurring in the Kutztown zip code could be from the tiny sliver that's in our district, but we know that it's highly unlikely due to the insights we have gained from the Department of Health. We know that the preponderance of the Kutztown positive cases are attributed to the university and Kutztown itself. Utilizing weights in this manner allows us to drill down to a more accurate picture of our district level data and helps us understand why our data as reported at a zip code level by the state may not be an accurate representation of our school district. All right, so what does our data look like? One metric we track is the number of new positive cases per day. Using the data analysis techniques I described before, we can plot data over time to see better visually and understand it. The blue is new cases in Lehigh County. The green is Northwestern Lehigh with unweighted data, or in other words, including all zip code data from everything like Kutztown, Breiningsville, Slatington, etc. The yellow is Northwestern with weighted data, or only applying a portion of the COVID data to our district. As the chart highlights, Lehigh County data is far exceeding our both local and weighted and unweighted new positive case rates. When we examine the Northwestern weighted data, we could see that our community is not experiencing a moderate level of community spread. What's even more interesting is when we examine the data at this level, we could correlate certain spikes to non-district events. For example, when we examine the green spikes in early August and September and uncovered what zip codes drove that data, we recognized that the increases were associated with the Kutztown zip code, and that was the approximate time the university went back into session and that community had a localized outbreak. Because the data is reported by zip code and not school district, it has the potential to artificially inflate the school district numbers. This level of analysis helps us better understand the context of the data. Providing context to the data is key to understanding numbers. Without context, numbers are just that, they're just numbers. Here we show you another example. These charts provide a side-by-side comparison of the daily number of COVID cases to the number of tests administered at a state level. If one would focus on the left-hand chart only, they may reasonably draw a conclusion that cases per day are growing at a significant rate. They may assume this is attributed to the rate of spread among communities, and quite frankly, that chart looks scary to me without any type of context behind it. However, to better ease my anxiety, we compare it with other pieces of data. If we compare both of these charts simultaneously, we could draw another hypothesis. Epidemiologists in the Department of Health have shared at our regional meetings at a number of times that a significant factor causing an increase in daily COVID cases statewide and regionally, it can be somewhat attributed to the increase in healthcare facilities' ability to administer the test. In simpler terms, the doctors and DOH are suggesting to us we are administering 30 to 40,000 tests a day in comparison to 5 to 10,000 in May. Therefore, naturally, we will see an increase in daily positive cases identified. For that reason, our medical advisors in the DOH suggest we focus on the metric of percent positivity for PCR tests. This metric is one of two that determine the recommended instructional model we could offer at Northwestern. This measure reflects the percentage of PCR tests administered that result in positive cases over time. This metric provides a more accurate portrayal of our level of community spread. Positioned on the chart are thresholds that define the level of community transmission in the county. As the graph illustrates, the level of community transmission in Lehigh County is currently and has been at a lower level. Another key measure PDE requires districts to use to decide what instructional model to implement is the incident rate per 100,000 residents. As before, we applied that same level of analysis to the data, and as before, you can see how applying those techniques allows us to normalize the data to make more local decisions. The key difference this time is that we utilize ratios to determine the incidence per 100,000, because honestly, we don't have 100,000 people living in northwestern boundary. Our population is closer to 26,000. Again, on this graph, we've applied the PDE thresholds for community spread, which is one of the metrics that PDE recommends that schools use to determine what instructional models to be in. The recommended instructional model for the area and threshold, which Lehigh County and both our northwestern and unweighted data reside in, suggests we should not be offering a full in-person model without social distancing of 6 feet at this time. Detailed review of the Department of Health data is not the only means by which we base our decisions on. We also consider other quantitative and qualitative data. The CDC, for example, has provided indicators that we could use to aid in our decision-making process regarding in-person learning. Beyond the new cases and PCR tests, which we already discussed, the CDC tool also has us consider our ability to consistently and effectively implement 5 key mitigation strategies, which are mask usage, social distancing, hand hygiene, cleaning and disinfecting, and contact tracing. Additionally, we attend weekly meetings with state and regional advisors from the Department of Health, Lehigh County Emergency Management, and Lehigh Valley Health Network. These meetings provide greater context and education of the data we've collected, trends, and why they are occurring. For example, because they have access to the PA-NED system, they could better describe to us how a spike in cases may be attributed to a localized breakout in a nursing facility, a single business, a university, or due to a family gathering that occurred over a weekend. These meetings also allow us to stay close to the latest developments surrounding COVID-19 from a health and safety perspective. Much has been learned over the last 8 weeks since school resumed, and that has provided medical experts and scientists rich data on how schools fit into the greater context of community transmission. Honestly, I recognize that I just reviewed a lot of data and it can be overwhelming. Believe me, I live this every day and it still can become overwhelming for myself. However, our goal tonight was to share this information with you to provide a level of understanding of some of the elements we consider when making decisions. It's important for you to know that we are committed to continuing to use sound research and data as we plan a path forward, all the while leaning on our local and health officials and partners for their expertise. Please be reassured that we do all of this in the best interest of the health and safety of our students, staff, and our community. At this time, I'll turn it over to Mrs. Holman so she can discuss instructional models that are available to us and the impact they have on our youngest learners. Mrs. Holman.
Thank you, Dr. Sosnovik. When you look at our student enrollment by building that you see on our screen, thank you. When you see it on the screen, when you look at the student enrollment by building and the instructional models and the percentages for each building, there are only select locations that can accommodate the numbers per grade and per class. At some other local school districts, and I know Saucon Valley and Catasauqua have been mentioned in the past, they have a percentage of students that have selected online only, which reduces the number of children in each classroom and certainly allows for 6 feet of social distancing. The chart on your screen shows the students that we have currently attending in our 2 to 3 day hybrid week model. If you assume all of the students who are currently in our hybrid model will select to return to a 4 day per week model, we would have by building somewhere between 76% and 82% of our students who wish to return. For example, we have classrooms in our district that are somewhere between 700 to 900 square feet. They usually accommodate 30 learners, up to 30 learners, and 1 to 2 adults. This same classroom can accommodate 15 to 18 students with 6 feet of social distancing. Yet on average, we have 25.5 students on average who wish to return to school. So we're fortunate that we have so many families that wish to send their children back to school. However, this is where one of our very large challenges lies. We did recently survey families of kindergarten and first grade families about their intentions for the second marking period, and 86% of our kindergarten families and 80% of our first grade families wish to return to school. We thought it was important to provide you information on the different instructional models and information about social distancing. You will see a blended model described by the state is any model that allows for the number of students as reduced to allow for social distancing of 6 feet. So many local school districts, like those I mentioned on the last slide, are in a blended model, even though they have students back to school 4 or 5 days per week, because they are able to afford the 6 feet of social distancing that has been recommended by the Pennsylvania Department of Health and the Pennsylvania Department of Education. You will also see social distancing requirements that vary by organization. Some organizations, such as the World Health Organization, believe 1 meter or 3.28 feet is appropriate social distancing. Pennsylvania and the Department of Health, as well as the Department of Education, has aligned with the CDC, or the Center for Disease Control, which recommends 6 feet between individuals, which is the current recommendation for all Pennsylvania K through 12 schools. On August 10th, the Pennsylvania Department of Education and the Pennsylvania Department of Health released a metric for schools to use to determine instructional models. The distance is built upon 2 public health metrics. You'll see them on the slide on the right. The guidance is incident rate per 100,000. You heard Dr. Sosnovik mention that earlier, over the most recent 7 days, as well as the percent positivity over the most recent 7 days. These reports are provided on a county level each week. And each week since July 31st, when it was introduced, Lehigh County has been categorized using the above metrics in the moderate category. You will see moderate is recommended blended learning model or full remote learning model. Because of the positivity ratings Dr. Sosnovik discussed earlier, we are in the low for the positivity rating, and you will see that indicated on the chart, and we are in the moderate for the incident rate. This data does change daily with a cumulative report at the end of each week, delivered to us on Fridays. We watch these statistics by county, as well as the zip codes that Dr. Sosnovik mentioned earlier. We watch them very carefully, as well as any incidents that happen in our school or in our county. As these statistics come in weekly, should we move into a substantial spread or have an issue in one of our schools, it could consider an abrupt move to a full remote learning model, and we need to be prepared to pivot quickly. The blended learning model that we're currently in for 2 to 3 days per week is described on your screen. We did give advantages and disadvantages. When gathering the information about advantages and disadvantages for each of the models, we know that there have been certain advantages for the 2 to 3 day week per model, and that has provided us advantages. I do believe it gave our students the opportunity to adapt to all new social distancing protocols. It also allowed for the 6 feet of social distancing in each classroom across the whole district. It is designed to help minimize the spread from one cohort to the other by having 2 self-contained groups that don't cross one another. However, our staff do cross cohorts. It permits mass breaks in the classroom with the social distancing in each classroom. It also allows us to adhere to the cleaning of supplies and limiting shared materials. With our youngest learners, hand washing takes a significant amount of time. But with small groups, it has been limited in terms of losing instructional time in the blended model. With less than half of our children on any given day in school in person, it has also allowed us to limit close contact on school buses. However, we also recognize there have been disadvantages with the hybrid model as well, and some of these disadvantages are dependent on the age of the learner. We have difficulty sustaining engagement with some of our youngest online learners. It is challenging when trying to maintain the same scope and sequence when there are different modalities in each of the classrooms, and thus planning for different modalities will continue to be necessary. We have experienced some difficulty supporting students who are not demonstrating with success remotely. They are missing academics, but they are also missing peer interactions and socialization. And obviously the hybrid has increased screen time for students. The blended model, which is also a hybrid, but it is 4 days per week, as we talked about in one of our recent meetings, will provide more consistency in attendance for most students, but students will be closer together within the classrooms. Some of our classrooms have room to accommodate the students at 6 feet and some do not. If there is room to accommodate students with 6 feet of social distancing, the student movements will be restricted during the day, as they will primarily be at their desks in the classroom. We also recognize that in an effort to spread desks out across the entire classroom, some students may need to sit near a door, windows, sink, or ventilation unit. Students will experience an increase in academic as well as social and emotional opportunities and with more in-person instruction. This includes positives in engagement and accountability, as well as the ability to make connections and retain the material without the gap in time. As long as there are families who are opting into online and/or students who might come in or out of quarantine, it continues to add challenges where there will be varied instructional models within the same classroom, which is why we will need additional time for planning as that instructional model continues. As we move forward with an increase of students in person, there could be an increase in cases that could disrupt school or could close schools more frequently. Overall, the educational benefits that a 4-day per week model will provide, as long as we can maintain 6 feet of social distancing and maintain all of our other health and safety protocols, is something that we believe that is beneficial for some students. All of that being said, all of us, from teachers to administrators, as well as I'm sure all the families on the call, recognize the group of learners that has experienced the most significant challenges are our youngest learners and their families. Our youngest learners need consistent opportunities to participate in active learning and hands-on content. The time on task for this age group is more limited because of their age. At this age, they need significant amount of support, as well as their autonomy and independence as a learner is having an impact on their learning. They need consistency in routine and structure to maintain the academic skills and behavioral expectations. We also recognize that our students at this age need support from families, parents, grandparents, daycares to fully engage in learning while at home. We also realize that this is an opportunity where the potential exists for 6 feet of social distancing in our K and 1 classrooms. To accommodate this distance in each of our classrooms, we will need to remove furniture, rearrange furniture, purchase storage and other materials, as well as some students will need to move classrooms, teachers, and even some students will need to change schools. We have spoken to our medical team at Lehigh Valley Health Network, and a phased approach to returning additional students to our classrooms while adhering to the 6 feet social distancing is supported by them as the best path moving forward. This will allow a phased plan that will allow us to address changes to the classroom and building assignments, staff assignments, and do so one step at a time. The following adjustments will be made after the start of the second marking period, effective November 16th, 2020. We will transition all K and 1 students to a 4-day per week model, blended instructional model, with Wednesday remaining an online learning day. We will continue with grades 2 through 12 in the current instructional model at this time. We will continue to evaluate the data, including the size of our classroom space, as it is the most challenging barrier to making a recommendation to return to a 4-day per week model. The district will also continue to offer an online instructional model with a Northwestern Lehigh teacher, digital academy, or homeschool program as options for the second marking period for all grades. Next steps. Tonight, we will be sending a letter to all of our families to inform them of this change. It will include a link to this presentation and video in case they were unable to join us tonight. For all kindergarten and first grade families, building principals will contact families whose children will need to be changing classrooms or teachers or buildings using the data that you submitted on the survey. For students in grades 2 through 12, if you wish to make a change to your child's instructional model for the second marking period, the letter will ask you to email the office to request a change by next Tuesday. After this date, families will not be able to change instructional models. If you are in need of a transportation adjustment, please also email the transportation office by next Tuesday. I would like to take this opportunity to remind everyone of some of the health and safety practices that are important every day, but especially through any transition. These are just a reminder of the good prevention habits we are trying to enforce in school and asking for your help to do so at home too. Consistent and effective use of face coverings. You will see an example from Lehigh Valley Health Network on the right that shows a child wearing a face covering that has a snug fit against your child's face. It covers the nose and the mouth, and it does not fall down. The fabric should be 2-ply, not sheer, and does not have vents. Face coverings that fit this criteria are acceptable by the school. Please know that the building principals will be following up with families if a face covering is not compliant with our protocols. Everyone is encouraged to use appropriate hand hygiene and respiratory etiquette, including washing your hands regularly with soap and water, or using hand sanitizer if soap and water is not available. If you need to cough or sneeze, please do so with a tissue or your elbow, but not with your hands. Lastly, avoid touching your face and mask. We also focus on cleaning and disinfection within our schools, and this might include routine cleaning like you do in your home and disinfection of our highly touched surfaces and objects. Lehigh Valley Health Network, our medical partner, has developed a website called School Partners. They have informational videos on how to be safe at school, on transportation, in sports, and stress and anxiety during COVID. In addition to the videos, they have also offered all Northwestern Lehigh students and employees access to a 24/7 video screening, as well as expedited testing for COVID with a quick turnaround for results. All of the videos and screening testing information is available on our COVID-19 website and also at the LVHN School Partners site that is listed on the right. We need your help to keep our schools open. We've said it from the very beginning. We need all employees and all parents to perform the screening each day before coming to our buildings. We need you to reinforce good prevention habits with your children each day. And also, most importantly, keep your children home if they are sick. Know that building principals will follow up with families who are not performing the daily screening. Our entire goal is to continue with our instruction with students, maintaining in-person instruction while remaining committed to the safe and thoughtful path forward. Our goal will be to keep our schools health and safe together. I believe we have Mrs. Yadish on the line to be able to ask us some questions that we've received. And so I will turn it over to Mrs. Yadish at this time.
Thank you, Mrs. Holman. We do have a few questions here. The first question is, will some K-1 students need to switch teachers or buildings to ensure that the district can maintain 6 feet of separation if the children are at school 4 days a week?
I will certainly take that one. Yes. And so I mentioned about our kindergarten and first grade students will need to, some of them will need to move classrooms. We will make our best effort to keep students in the classroom of their classroom teacher. However, our classrooms typically with a 6 feet social distancing accommodate somewhere between 15 and 18 students. So in order to maintain appropriate social distancing, there could be moves for teachers or buildings that are necessary as we bring students back 4 days per week, as is the case with kindergarten and first grade.
So just as a follow-up, just to clarify, will this be needed if the district decides to offer this to other grade levels? And if that is the case, how will that be determined at that time?
Yes, in many of our grade levels, not all of them, there will be moves that will need to be necessary in order to accommodate the social distancing. We will ask for obviously volunteers. The way we did it with kindergarten and first grade is obviously ask that question to families if they would consider a building switch. And so we would accommodate the same request should we need to consider that in grade levels moving forward.
Thank you. The second question, if the number of students testing positive for COVID increases in our elementary schools, will we go back to the blended 2 to 3 days per week model? If so, how far in advance will parents be notified of this change?
Dr. Sosnovik?
Yeah, I'll grab this one. We'll share the questions. So, thank you for the question. The potential does exist that we may need to adjust how school is delivered, but it really is dependent on a number of factors. Our goal is to provide as much notice to families as possible to help with any transition that we make. With that said, an outbreak could occur at any time in any of our schools. If it does happen, the PADOH may recommend that we go fully online immediately. And as we've communicated in the past, we might have to make that call similar to a snow night the night before. So we recommend parents to always be prepared with a plan in case, unfortunately, they get that call.
Thank you. The next question. Some local school districts that are similar in size to our school district have been back to school full-time since the beginning of the year. Other districts have all of their kids back full-time starting early November. How is it that other school districts are able to do this, yet our school board is citing state regulations and CDC requirements as a reason why we are not able to do so?
I will take this one. I mentioned during the presentation, there are at least 2 local school districts. I'm sure there are others that are considering or have either since the beginning of the school year or are considering moves moving forward to either 4 or 5 day per week model. On the slide that we talked about instructional models, any model that allows for the 6 foot of social distancing is a model that's considered a blended model. Some of the districts that are locally have them scaffolded, meaning that certain grade levels are offered different instructional models. And so it could be because of the composite of the class and some districts having an increased number more than what we have in terms of online students. And obviously when you have a composite where you have a higher percentage of students that choose online, it automatically lowers the density of the students that are in your classroom. We, as you saw on the slide, have a high percentage of students that want to return. So as much as that we are fortunate for that, parents wanting to send their children back to school, it is where we experience one of our largest challenges. I mentioned a square foot of a classroom, which they vary across the district. That typically accommodates up to 30 learners with 1 to 2 adults. With 6 foot social distancing is down to 15 or 18 students. And so that's why the need for the moves. Our building principals have gone through almost every space and measured and recognized the number of students that classroom can fit at 6 feet social distance, as well as the number of students enrolled in that classroom and want to return. We need to be able to consistently implement the safety protocols in order to consider a return. And I would tell you there are spaces in our district and buildings in our district that can't accommodate the 6 foot social distancing right now.
So this is a similar question, so I'm going to follow up with this one. Will there be an option for kids to go back full-time or at least 4 days per week in the second marking period for those families who wish to send them back? If not, what can we do to help ensure a safe reopen by the third marking period?
A decision to return to school is based on many factors, as I think we tried to explain tonight in terms of data, sizes of classrooms, percentage of people or students who want to return. Data like we presented tonight, as well as the enrollment data that we presented. It also includes our ability to implement the mitigation strategies. And I mentioned one of our largest challenges is the 6 foot social distancing, and whether or not we can implement that in any given space will be a large factor in our decision to return students or not being able to do so. We will continue to evaluate all of that data. Right now, you heard that we are making the change for K1. We will continue to evaluate each and every classroom moving forward to make the best recommendations we can moving forward.
Thank you.
I'll grab the next one, Jen, to give you a break.
Sorry. This is a question about classrooms at Weisenberg. I understand there are empty classrooms at Weisenberg Elementary. Are these being considered as viable options for Northwestern elementary students to help ensure smaller classes and social distancing?
Absolutely. Again, thank you for your thoughtful question. You're right. There are a number of empty classrooms at Weisenberg, and I will tell you, we are considering them in all of our planning efforts as we move forward. It's important to recognize, though, that they are only one piece of the overall solution. Even though we do have available classrooms at Weisenberg, that may address our spacing issues, but we will still need a teacher to fill those classes with those students. As Mrs. Holman shared with you tonight, we will need to move some students to another teacher or building to bring kindergarten or first grade back 4 days a week. So we are already considering those empty spaces and or smaller class sizes at Weisenberg.
Thank you. This is a follow-up question about some things that happened this summer. Why hasn't a survey gone out recently to parents to understand our thoughts and perspectives? We had one over the summer, and it seems like we should have had a follow-up survey once school started.
Certainly, I can take this one. We did, as I said earlier, send a survey out to K-1 to garner some thoughts about their instructional models as we move forward with other grades. Instead of sending a survey and asking you to select a model, we figured we would take requests for instructional model changes. But we did look at that information from our K-1 as we looked at planning moving forward with them about what instructional model they intended to choose, so that we made sure we can use that in our planning efforts, as well as information about students who might have wanted to switch schools or been willing to switch schools as a result of the survey.
How can the Northwestern Lehigh School District continue to ensure the safety of students who are attending school in the hybrid model if COVID numbers in the Lehigh Valley continue to increase?
I'll grab this, Jen. Although we would love to say we can ensure absolute safety of our students and staff against this disease, I'm going to be honest, we can't state that. It brings to mind what a doctor shared with us. And what he shared was that we're dealing with risk mitigation and not absolute certainties. With that said, you have our absolute commitment that we will continue to monitor the data, consult with medical professionals, and make adjustments to our plans and procedures when necessary, so we can continue in-person school to the greatest degree we can. I will say the school's just one portion of this, though, and Mrs. Holman alluded to this earlier in some of her statements. Parents need to be a part of this equation of safety at Northwestern. They need to continue to take an active role in helping us. And this means making sure that you're doing your screenings every day. Don't skip days. Please screen your kids every day. Ensuring that you're adhering to the health and safety reminders that we reviewed tonight. Reviewing them with your son or daughter. All of these layers of mitigation strategies are what is allowing us to increase this in-person instruction and also have the level of instruction we have now. And so we're asking for your help because you have our commitment, but we need yours as well to help us in our buildings with our kids to make sure that this is the safest environment we can bring them in.
Mrs. Holman, you talked about this, and I think you're part of the presentation, but I'm just going to ask this anyway. Why would any of our school board members consider going against the health metrics designed by the Pennsylvania Department of Health to keep students, teachers, and others safe during this surge in the pandemic and bring students back into schools in person more?
Yes, I did address part of this, but I'll certainly answer the question directly. Our administration and our school board, as we look at each of the data and report out regularly, all of the decisions have been and will continue to be in line with the best advice we can. As you saw, there's some differing metrics in terms of different organizations, but as the county remains in moderate, you saw that our options were a blended instructional model or a totally remote model. As data changes, we could end up in low or we could end up and substantial as the year progresses. But right now, the model, even though we're returning additional students to school, would still be considered the blended model because we don't have all of our students back. We still are giving an option for some students to learn online, but we are offering an option for them to return 4 days per week. As you heard during the presentation, we regularly meet with our medical advisors from Lehigh Valley Health Network. They're supportive also of a phased return. And so whether it be, return to school guidance or sports guidance, our board is regularly updated, as well as our administrative team, on the best medical recommendations and take those into account, and wouldn't do anything otherwise.
Thank you. This was also talked about briefly, but a question I think for Dr. Sosnovik: when and how will the school district determine if we will need to go to full remote learning for our Northwestern Lehigh students?
Yeah, we did review a lot of different data metrics that we look at a daily basis. So, the two key ones that the State Department of Health and Education requests that we look at and to base decisions are on the incident per 100,000 and the PCR percent positivity. Both of those are used to determine and define the level of transmission within a community. And as it's reported, it's at a county level. But like I shared earlier tonight, we look at data much more granular than a county level. We look at zip code data, we look at other qualitative data. We use a lot of different data sources to help drive our decision. And, with all of these numbers, we consult, with our medical advisors and Department of Health, who are the experts in this area, to help allow us to better understand what's happening in our community, within our school district, regionally, provide the context needed to understand it, and then, help us determine the right course of action.
Thank you. And this one is about kind of the timelines of something you were just talking about. Will the school district give families advance notice of changes to the school instructional model if possible?
I'll certainly take that one. Everything is sure if it's possible, just like we're giving you notice tonight. And so I said tonight our change for K1 is effective November 16th. And so we are trying to give you some time, as well as our teachers, to prepare and prepare to have a smooth transition for our students. That notice might or might not always be available. And so Dr. Sosnovik mentioned several times there could be a potential change to a remote learning model. That could be one of two reasons. That could be a change to substantial in the county, or that could be a number of cases in any particular building that make that change. That notice will likely be abrupt, and we will have to pivot quickly for both of our teachers as well as our families. But certainly we want the transitions to be as successful as possible. And so we will be able to provide notice when we're able, but I can't tell you that we're always going to be able to do that. And so one of the information we gave out at the beginning of the year is trying to be prepared with childcare arrangements, et cetera, because we can't always anticipate some of those changes.
Okay. Just a few more here. How many kindergarten and first grade students have agreed to transfer at this time?
I can certainly field that one. I don't know the exact number, but we have more than what we need to transfer. And so what will begin to happen tomorrow is one of the building principals will be reaching out to some of those families and make some of those changes. And so I don't know the exact number off the top of my head, but we do have that on a survey. But we have more families. It's the only way we would come out and make a recommendation for K1 is if we knew that the results of the survey, as well as what we could do in the classrooms, were physically possible. And so we do have the number of families that we need to transfer.
Will the hybrid model for grades 2 to 12 be in effect for the entire second marking period, or go to full remote if needed? Is there any chance it would switch to the 4-day model before the end of the second marking period?
I could grab this if you want, Mrs. Holman. Yeah, absolutely. I'm going to say that we're considering every day our next steps. And so we're not locking in 2 through 12 for the entire second marking period. We are committed to looking at the data daily, meeting with our medical team, best understand the new data that presents itself. The data that's available now provides a historical perspective, and then we can surmise from our medical teams what we can look to expect as we move into a holiday season, move into a flu season. However, hopefully, if the data and the COVID cases are favorable, we may be able to bring back additional grade levels in that phased approach that we discussed earlier today.
Thank you. If a parent is currently providing transportation and can no longer provide it for their children, can they opt to have transportation provided during the second marking period?
Yeah, I'll take that one. Yes, on one of the slides, as well as in the letter tonight, you will get, if there is a need to change transportation, the email and the information to change that would just be a request to transportation. Please give us a few days notice to make those changes, but certainly the email address will be in the letter that you will receive this evening to be able to change your transportation arrangements that you currently have.
Other than faculty and staff, is anyone else being allowed in the schools, in the buildings, in the district buildings, specifically relating to student teachers as well?
Yeah, I could grab this, Mrs. Holman. Absolutely. So we have a health and safety plan that defines who is permitted in our buildings. We have dramatically reduced the number of outside visitors to our facilities. We are conducting many of our meetings online via Zoom, similar to what we are experiencing now. We are looking to do conferences online. We are looking to hold IEP and other meetings with parents online. Vendors and other individuals that meet with us, we, to the greatest degree possible, do everything virtual because we don't know who or where individuals may be coming from. With that said, there are specific instances that we do permit people to come into our facility and we don't have the ability to prevent that. For example, like children and youth, let's say. But for any visitor that we do allow in our building, we make sure that they follow the same screening protocols that all of us follow that are in our buildings. They come in, they fill out the screening procedure, they have to be, get their temperature administered, and all of that is conducted prior to allowing them in the general population with our students and staff.
Thank you. Will any change be occurring for fully online learners? And can consideration be given to these students maintaining their same teachers since some have already experienced a change this year?
I can grab that one. The only change could be is if we have a significant reduction or a significant increase in learners. And so right now, if you selected to continue with online learning, I anticipate that you will have the same teacher. There are some online learners that have chosen 4 days per week model. And so if that is the case, your teacher will most certainly switch because our online teachers at our K1 level are specifically online. And so if you were an online learner that requested to come back and switch, your teacher will switch to an in-person teacher. That being said, this year we did add a teacher into our online, those that were responsible for online learning because of the numbers. And so we're always really cognizant of making sure that the class sizes, even though they're online, are appropriate as well. And so I would say that there could be shifts. I don't anticipate that to happen with this change, but if there are a significant reduction or a significant increase in online learners, that's possible.
And as a follow-up to a few of the last questions, if the school district would decide at some point to bring back the other grades 4 or 5 days a week, will the option to continue 100% learning online with Northwestern Lehigh teachers be offered for the remainder of this year?
Yes, we anticipate that it will for at least the foreseeable future. When there is a decision point where the instructional model would change and we would bring everyone back, obviously the online with a Northwestern Lehigh teacher would cease to exist. I can't tell you right now when that time will be. You know, there's lots of things that are coming in the future in terms of, you know, increased testing and vaccinations and things that certainly could change in the future and make a in-person model more probable. But right now, for at least the foreseeable future, the online model will remain an option for the foreseeable future.
Okay. Just catching up with some questions here. One moment. What are some of the lessons learned in the first quarter with the district mitigation plan and learning model?
Well, I'll tell you the first one that jumps out at me. Our kids are awesome. And I say that because honestly, we've asked them to completely come to school and be in an environment and learn an environment that is completely foreign to them. And when I say that, I mean all the mitigation strategies that we put in place. I think one of the most fearful things we had coming in was the mask usage within our schools. This was a major concern, not only for administrators, teachers, but families alike. And a lesson learned that I take away from all of that is our students are resilient. And I always knew that, but it just reinforced for me through the start of this first marquee period. They rolled with the punches. We had, I can't recall a single mask incident, throughout the entire school community. And, I was just extremely proud. Some of the other things that we learned as well is as we started to, get cases happen within our schools, we were also pleased that our procedures worked as well as they did. We were able to, isolate situations. Our communication protocols with the Department of Health and our medical team worked well. And we were able to handle those situations quite effectively. When we do debriefs on all of the situations that do occur, we do see areas that we can tweak and improve. And that's just our commitment to a continuous improvement of this plan. That way we can be as nimble as possible as we move forward into the future. So those are some of the takeaways from me. Mrs. Holman, did you have any more to really add?
Yeah, I agree. Our kids are awesome. I agree that our teachers, and I mentioned this in one of the other school board meetings previously, that, certainly in what I believe in comparison to other school districts in the county, and I said I'm a little biased, but our teachers have gone above and beyond in terms of, meeting all of those modalities that we've asked them to do. It certainly has met all of the needs of the students in those variety of modalities and allowed us to continue to maintain students instead of them leaving for a site or a charter school, which certainly has a cost impact to the district. And so, I recognize that that's not easy, and what we've asked them to do is not easy, and what we will ask the K-1 teachers to do is not easy, even though they're going to continue to manage students online and in person, but know that they will do the very best they can in terms of meeting all of our students' needs with the students' best interest at heart. Mrs. Yash, I think we have time for one more question or so.
Okay. If there is a snow day, will there still be online learning occurring at home? Also, when there is a delay, would students and teachers be responsible to complete online assignments? They said the bad word, Mrs. Holman.
Yeah, you did, the S word. I'll certainly take it. If there's one thing I like less than snow, it's probably a pandemic, however. So, I'll take snow at this point. So a snow day, thank you for the question about snow days. One of the things that was on a board meeting agenda several meetings ago is about what's called the Flexible Instructional Day. You will get some communication about that shortly, both for parents and students, but there is a procedure that the Pennsylvania Department of Education has for what's called the Flexible Instructional Day. It is a day to be able to be used for emergencies, typically weather-related emergencies. The pandemic has thrown a little bit of a wrench into the plans for what was previously flexible instructional days. You are permitted to, by school code, use 5 days as flexible instructional days. Obviously, many of our days now are remote, and so some of that gets crossed. But yes, as long as the emergency proclamation exists, we will continue to use the remote days, but we will also have the availability to be able to use a flexible instructional day. So you'll get communication about how all of this is going to work. But it would be a message that instead of saying the building is closed and the school is closed, we would say tomorrow will be a flexible instructional day. Please log on to your teacher's classroom for assignments the following day. So they were able to use at least 5 of them. And yes, if it is used for a school day, the assignments that the teacher gives you, one of 2 things the state has given us a requirement for in terms of the pandemic was one of 2 things. Either a student needs to be physically sitting in a seat in order to count for attendance, or they need to be able to complete the assignments provided by the teacher in order to count for attendance that day. And so that's how on that remote, whether it's a remote instruction day or a flexible instructional day, will be utilized.
Thank you.
If there are additional questions, I'm sure there's questions that will come in or after you have a moment to think about it. If we didn't address your question tonight, certainly send it in through admin contact. So that's the admin contact at NWLSD.org, and we will get back to you and address your questions. Sometimes after you think about it a little bit, you might have some additional questions. In closing, I would just like to say we appreciate all of your thoughtful questions tonight and certainly spending some time with us. Please rest assured that our commitment to our employees, our students, and our families to make this the very best educational year in the safest way we can. And thank you and have a great night.